Imagine feeling this intense fear, not from heights or spiders, but just stepping off a curb.
Yeah, that simple act of crossing the street.
Exactly. Today we're digging into something called agyrophobia. It's this specific anxiety, this fear of crossing streets that can, well, really turn daily life upside down.
It really can. And it's important to understand this goes way beyond just being careful in traffic, you know?
Right.
It's a genuine anxiety disorder. The fear is overwhelming, causes real distress, and makes people avoid roads altogether.
So our mission today is to unpack that, what it is, where it might come from, what it feels like, and crucially, what can actually be done about it.
Yeah, looking at the insights we have and experiences people have shared.
Okay, so let's get right into it. What exactly are we talking about when we say agyrophobia?
Well, agyrophobia is the main term. Sometimes you might hear dromophobia too, that comes from the Greek for racetrack, sort of emphasizing the road aspect. But fundamentally, it's this persistent and really irrational fear of crossing streets or highways, any road with traffic, basically.
So irrational meaning it's more intense than just standard caution, like everyone's careful crossing the road, right?
Precisely. That's the key difference, being cautious around cars.
Mm-hmm.
Totally normal, even necessary.
Sure.
But agyrophobia is an anxiety disorder.
Right.
The fear level is just way out of proportion to the actual statistical risk. And often the person experiencing it kind of knows this intellectually. They might realize the fear is excessive, but they still feel that intense anxiety anyway when they face crossing.
So what does that intense anxiety actually look like or
Yeah.
feel like? What are the symptoms?
They can be pretty wide-ranging, both physical and psychological.
Yeah.
Physically, you might see things like a really rapid heartbeat, sweating, feeling short of breath, maybe trembling or shaking.
Wow.
Yeah, and even nausea, dizziness, sometimes chest pain, muscle tension, or a really dry mouth. It's a significant physical response.
That sounds incredibly distressing just on its own. And psychologically.
Psychologically, it's that overwhelming fear or dread, even just thinking about crossing a street.
Just the thought.
Yes, it can spiral into full-blown anxiety attacks or panic attacks for some. And it leads to actively avoiding crossing streets whenever possible.
Which must be hard to do.
Very hard. It also involves irrational thoughts about what could happen, feeling like you're losing control, being hyper-aware, hyper-vigilant about traffic.
Like constantly scanning.
Exactly.
Yeah.
And this deep fear of getting injured or being in an accident, that feeling of, what if a car swerves? Could I react fast enough? That loss of control fear is powerful.
I can only imagine. It sounds like it could completely restrict someone's life. How does it typically play out in their day-to-day?
Oh, the impact could be huge, really significant. People might start avoiding essential things, going to the grocery store, getting to work, seeing friends, if it involves crossing a road.
Right.
They might take incredibly long detours, adding loads of time to their journey, just to avoid a crossing.
Just one crossing.
Sometimes, yes. Or they become reliant on other people for help with things they could otherwise do themselves. It really hits their independence and social life hard.
Yeah, that makes sense. So it makes you wonder, where does a fear like this even come from? What are the potential roots?
Well, like a lot of phobias, there isn't one single exact known cause. It's generally thought to be a mix of different factors coming together.
Okay, not just one thing then. What kinds of factors might contribute? What makes someone perhaps more likely to develop it?
Traumatic experiences are definitely a big one.
Like an accident.
Exactly.
Yeah.
Either being directly involved in a traffic accident themselves or maybe witnessing one. We hear accounts, for instance, of someone seeing a friend get hit by a car, and that image, that trauma, leads to this lasting fear.
Oh, wow. That's understandable.
Also, having other anxiety issues already can play a part. If someone has, say, generalized anxiety disorder or panic disorder, that existing anxiety can kind of latch on to street crossing situations.
Ah, so the anxiety finds a specific target.
Sort of, yeah. The underlying vulnerability is there, and it focuses on this specific scenario.
What else might be involved?
Learned behaviors could contribute. Maybe an upbringing where road safety was emphasized to an extreme, instilling excessive fear rather than just caution.
Like overprotective parenting.
Potentially, yes. And then there are genetic and environmental factors. A family history of anxiety disorders might make someone more susceptible.
Nature and nurture, kind of.
Exactly. Even broader cultural things like how much a society emphasizes road dangers could subtly influence these fears too.
So it's really complex, a combination of things, potentially. If someone thinks, this sounds like me, how would they go about getting a diagnosis?
The usual route is a psychological evaluation with a mental health professional.
Okay.
They'll talk through the person's symptoms in detail, look at their medical background, and really assess how much this fear is impacting their life. Sometimes they might use questionnaires or specific scales to get a clearer picture of the severity.
And ruling other things out.
Yes, absolutely. It's important to make sure there isn't another medical condition causing similar symptoms.
Right. So once a diagnosis is confirmed, what kind of help is available? What are the treatment options?
Thankfully, there are effective treatments. Cognitive behavioral therapy, CBT, is often a first-line approach.
How does CBT work for this?
CBT helps people identify those negative, often irrational thoughts and beliefs they have about crossing streets. And then it helps them challenge those thoughts.
Okay.
It also equips them with practical coping strategies to manage the anxiety when they're in those situations.
So tackling the thoughts and providing tools, what about other therapies?
Exposure therapy is another really key treatment.
That sounds intense.
It's done very gradually and in a controlled way. The idea is to slowly expose the person to the feared situation, crossing streets, starting with maybe less scary scenarios and building up.
Like a hierarchy?
Exactly, a hierarchy of fears. The goal is to build tolerance to the anxiety so the fear response lessens over time. It helps desensitize them.
Makes sense.
And alongside that, relaxation techniques are often taught. Things like deep breathing, mindfulness, progressive muscle relaxation. These help manage the anxiety symptoms in the moment.
Are medications ever used?
Sometimes, yes. A doctor might prescribe anti-anxiety meds or certain antidepressants, sometimes beta blockers, to help manage the physical symptoms of anxiety.
As a support.
Usually, yes. Often used alongside therapy, not typically as a standalone treatment for phobias, but they can help reduce the intensity while someone is working through the therapy.
And support groups.
Support groups can also be really valuable. Connecting with others who really get what you're going through can be incredibly validating and helpful for sharing coping strategies.
It's good to know there are different avenues for help. We've talked about the clinical side, but what's it actually like living with this day to day, trying to manage it?
You see a lot of personal stories shared online now, on platforms like TikTok even.
Really?
Yeah, people sharing their struggles. They talk about the elaborate planning to avoid crossings, the detours, sometimes feeling embarrassed or frustrated by it.
That vulnerability is powerful.
It really highlights that this is a real, legitimate struggle affecting people of all ages, and it can feel quite isolating.
Hearing that really brings home the impact. Beyond the formal treatments, are there practical things people can do? Lifestyle adjustments or self-help strategies?
Yes, definitely. There are complementary things that can help, like really knowing and sticking to pedestrian safety rules, always using crosswalks and signals that predictability can build confidence.
Right, taking control where you can.
Exactly. Choosing safer routes, perhaps with less traffic or better visibility, can help too. And leaning on support, asking a trusted friend or family member to cross with you sometimes.
That makes sense.
And practicing those relaxation techniques regularly, and actively challenging the negative thoughts when they pop up. Those are important self-management skills.
So it sounds like a multi-pronged approach is often best. You stressed the importance of professional help earlier. Why is it so crucial?
Well, while the self-help things are useful supports, tackling a phobia like this effectively usually requires professional guidance.
Why is that?
Because a mental health professional, especially one specializing in anxiety or phobias, can do a proper assessment, create a treatment plan tailored specifically to you, and guide you through therapies like CBT and exposure therapy safely and effectively.
They provide that structure and expertise.
Precisely. They have the tools and experience to really address the underlying mechanisms of the phobia in a targeted way.
And what's the outlook? If someone gets help, what can they realistically expect? Can people overcome agyrophobia?
The prognosis is generally quite good, actually. With the right treatment and, importantly, the person's commitment to engaging in therapy, many individuals can significantly reduce their symptoms.
That's encouraging.
Yeah, they can see a real improvement in their quality of life. It takes work, and sometimes long-term support or maintenance strategies might be needed, but significant progress is definitely possible.
Good to know. Before we wrap up, are there any interesting facts or maybe common myths about agyrophobia we should clear up?
Yeah, a few things. Prevalence-wise, estimates suggest it might affect around 2 or 3% of people globally.
That's quite a few people.
It is, and it seems to be diagnosed a bit more often in women than men. Also, it often co-occurs with other anxiety disorders. It might show up alongside panic disorder, for example.
Ah, okay.
And as we mentioned, CBT has shown really high success rates, specifically for treating agyrophobia.
That's great news for treatment. What about misconceptions? What do people often get wrong?
Well, one common mix-up is thinking it's a fear of driving. It's not. It's specifically the fear of crossing the street as a pedestrian.
Ah, important distinction.
Definitely. Another is that it's just an adult thing, but children and teenagers can develop it too. And while the name agyrophobia might not be as familiar as, say, claustrophobia, the experience is absolutely real and can be incredibly debilitating. Also, people might assume it stems from one single bad event, but as we discussed, the causes are usually more complex than that.
And thinking you can just get over it on your own.
Right. That's another misconception. Overcoming it often really does require professional help. It's not usually a matter of willpower alone.
Okay, so let's try to summarize the key takeaways here.
Sure. So agyrophobia is a real and impactful anxiety disorder. It's that intense, irrational fear of crossing streets.
Yeah.
It leads to avoidance, distress, and can really limit someone's life. The causes are likely a mix of things: trauma, anxiety history, learned factors.
But the good news is,
The good news is that effective treatments, especially therapies like CBT and exposure therapy, are available and can make a huge difference.
it really makes you think about the everyday things we take for granted, doesn't it?
Absolutely.
Just crossing the street. For someone with agyrophobia, that simple act can feel like climbing a mountain. So understanding and empathy go a long way. And if this resonates with you, if you're experiencing this fear, reaching out for professional help is a really brave and vital first step. Maybe think about, what small barrier could you help someone face today, just with a little bit of understanding?